I'm sure that this next 45 minutes to 1 hour promises to be very educative, and we want to try and provide as much information, knowledge to those who need it to be able to go through their journey successfully. Okay, so we'll go for a very quick commercial break. Please, just those who want to ask questions live, just prepare your questions. Those who want to send in their questions, if you've not done that already, send in your questions and we'll try and go through your questions. See you in a bit.
Georgia Abebe Art Foundation was set up in 2015 with the birth of our twins, Joshua and Jemima, ending 13 years of barrenness. The foundation was set up to be a support system to couples trying to achieve conception and to provide the necessary support such as spiritual, financial, psychological, and emotional support. Since inception, the foundation has played a key role in the journey to parenthood of hundreds of couples, and many today have received their bundles of joy. Georgia Abebe Art Foundation launched an audacious project to reach 10,000 couples in 5 years with IVF treatment. As we mark our second anniversary, about 5,000 couples have registered. About 2,000 couples have had their fertility consultation with specialists. About 600 couples have gone through the IVF program, with over 260 couples confirmed pregnant, over 250 babies, and many couples on their way to become proud parents. Amongst of which are couples who have waited endlessly for 29 years, but have been blessed with a set of twins, yet another for 32 years, and are now blessed with triplets. We say, to God be all the glory. As we celebrate God in praises and thanksgiving for the amazing act of God in the last 2 years of the Fruitful Project, we are confident that God is set to do more as He turns many more couples into joyful parents. For these 100 confirmed pregnant, we say thank you, Lord. For these hundreds of babies born to these precious couples, we say a big thank you, Lord. For the targeted 600 couples that will be confirmed pregnant this year, we say a very big thank you, Lord. For the hundreds and thousands of babies that will be born to couples waiting in line for their bundles of joy, we say a million times thank you, Lord. Genesis chapter 1 verse 28 shall be fulfilled in grand style. To God be the glory.
So once again, you're welcome. My name remains Dr. John Abebe. I'm the medical director of the Georgia Abebe Fertility Center and the president of the Georgia Abebe Arts Foundation. We are based in the city of Abuja. Welcome. Okay, so we want to start by talking about the burden of infertility. Worldwide, it is said that the incidence of infertility, next slide, is put at 15%. And what that means is that 1 out of every 6 couples will have a challenge achieving pregnancy or having their reproductive rights met. And that means that currently we're having about 48.5 million couples who are currently experiencing this burden worldwide. So, I mean, if you ask me, that is quite a huge number. It could be more than that. This is just an estimate. All right. Now, see in our practice, infertility is becoming one of the primary reasons for divorce among couples, particularly in this part of the world where a very high premium is placed on childbearing. And that means that if a couple is unable to have a child, then that couple is literally stigmatized. They always want to remind you of the fact that you are barren. Psychologically, it's a very serious burden. Up to 60% of infertile individuals are reported to have psychiatric symptoms like anxiety, depression. Up to 60%, more than those who are fertile, who don't have any issues with conception. And it is said that up to 41% of infertile women will have depression. That is huge, 41%. And so you see a lot of patients who come into our clinics and they've gone through a lot. When you listen to the stories of these women in particular, you know, it's clear that infertility is actually a burden. 87%, as high as 87% of women, infertile women, will have anxiety. Will have anxiety, they're anxious. Will I ever have a child? Will this phase pass? So now, infertility is defined as the inability of a couple to achieve conception after 1 year of regular, unprotected intercourse. Now, for women who are 35 and above, that duration is reduced to 6 months because the woman doesn't have that luxury of time to wait for 1 year before you start taking steps at treatment, knowing that at 35 years, that is when there is a significant drop in the fertility of the woman. So for women that are 35 and above, rather than wait for 12 months, after 6 months, they can come to the clinic and begin to seek for medical help. All right? So who is to blame? Nobody is to blame. All right? The causes of infertility can be broadly divided into the male factor that accounts for 30%, the female factor accounts for 30%, and the combined male and female factor accounts for another 30%. And then unexplained infertility accounts for 10%. What that means is that in 10% of couples who have difficulty achieving conception, it will be difficult to say what actually is the cause of the infertility after going through the normal routine investigations. So we'll just briefly look at the male factor, the male factor's infertility. And what we're actually looking at is looking at the sperm, because the sperm is actually the factor that determines whether there will be reproduction or not. The sperm from the man, and then the egg from the woman. But for the woman, there are other factors that will come into play. All right, that we will go into when we get there. But for the man, the main issue has to do with the sperm. And when we're looking at abnormalities with the sperm, there are 3 factors we consider. The first one is the count. All right, the count. We say that a man has a normal sperm count when the concentration is 15 million and above. That's according to WHO, 15 million and above. So anything less than 15 million means there is what? Low sperm count. Now, of course, you can now begin to talk about the severity of the low count. All right, is it 10 million to 15? Is it 5 to 10? Or is it less than 5 million? Is it less than 1 million? All right, so there are various, you can divide them into severity in that order. So apart from the count, you have the next factor is the motility. The motility. And we usually use the motility to determine how healthy the sperm is. Because if a sperm is not motile, when we say motile, means it's not moving, then it will be difficult for that sperm to carry out the process of reproduction, because you need the sperm to swim up when it is deposited in the vagina of the woman, all the way to the ampullary region of the fallopian tube to bring about fertilization. So if there is low motility, then it means that will be a very big challenge. In fact, motility is sometimes considered a greater factor than even the count. All right, so rapid motility less than 32% is considered abnormal, and then total motility of less than 40% also is considered abnormal. And then the third factor is the low sperm morphology. When we say morphology, we mean the normality of the sperm cell or otherwise. We expect that the sperm cells that are produced should have a normal form, meaning that you have an oval head, have a normal neck, have a normal tail. All right. Sometimes you could have a sperm that have two heads, that have two tails, that have an abnormal shaped head. All right. All of these are all abnormalities of the form. And once you have an abnormality, that sperm will not be able to carry out the process of reproduction. And so less than 4% is considered abnormal. So anything 4% and above is considered normal. So briefly, we just talk about the different factors that causes these abnormalities that we have just talked about. All right, just quickly run through them. You have the lifestyle factors: alcohol, smoking, drugs. All right, hard drugs, cocaine, marijuana. All of these would affect the sperm parameters. And then there's an important factor there, idiopathic. When we say idiopathic, it means it is not known. That is a very huge factor that causes male infertility. Why? Because up to 50% of the causes of abnormal sperm parameters is not known. And so we say it's idiopathic. And then you have undescended testes, meaning that the testes did not come out of the body of the male. It was trapped in the body. Instead of getting into the scrotum where it should be, it did not descend. And this is usually identified when the child is born. And if proper examination is not done to be able to determine that, and the testis remains undescended for a prolonged period of time, up to a year, that testis will definitely be impacted, and then the male will become sterile. Then you have infection. Infection can cause a challenge. All right, either infection of the testis, orchiditis, or infection of the tracts. All right, all of that can bring about a reduction in the production of sperm, or a transportation in the sperm that already have been produced. And then you have varicocele. That is when you have stasis or accumulation of blood in the veins around the testes. And what that does is to increase the temperature, and then that would therefore hinder the production of sperm. Sperm needs to be produced at a lower temperature than what the body's temperature is. And that is why the testes are contained in the scrotum, which is about 1 degree centigrade below less than the temperature that you find in the body. That is how it's meant to be. Then, of course, you have trauma. Trauma to the scrotum that involve the testes will lead to damage. You have torsion of the testes, meaning that they are twisted. If the testicles get twisted and it's not, that becomes a surgical emergency. And if it's not addressed immediately, that could lead to the damage of the testes. And then, of course, surgery. When men go through surgeries like prostatectomy, herniorrhaphy. Sometimes, if not properly done, you can damage the vas deferens, which is the dot that transports through which sperm is transported from the epididymis all the way out. And so once that is damaged, then definitely the man would have a challenge with reproduction. And then you have chemotherapy and radiotherapy for patients who have to go through cancer treatment. All of that definitely would damage the testes and its ability to produce sperm. And then you have genetic factors, all right? Turner syndrome, Turner mosaic, no, that is for the female. We're talking about Klinefelter syndrome. Sorry, Klinefelter syndrome, all right, or certain other genetic abnormalities, cystic fibrosis. There are certain genetic abnormalities that will lead to abnormalities with sperm. The testis not being able to produce sperm at all. All right. So these are some of this is not the total factors that are responsible, but just to highlight some of those common factors that could be responsible for the abnormal sperm parameters. Okay. And so we'll now go to the female factor. Like I said before, you have both male and female factor. All right. So next slide. What are the female factors that are responsible for or causes infertility? So you have the ovulatory factors. Ovulatory factor means that the woman is not able to produce egg. It's not able to release egg. All right. The eggs are contained in the ovary, and every month a woman is supposed to release at least one egg that will go on to be fertilized. Now, some women are not able to do that on a regular basis, meaning they're not able to do that every month. So some women will see their period, yet they have not ovulated. So what are some of the common factors that can cause anovulation or irregular ovulation? One of the commonest is PCOS, what we call polycystic ovarian disease syndrome. It's a very common syndrome. It is the commonest cause of anovulation. Now, in this syndrome, you have a woman who has what we call the polycystic ovary, meaning that she has a lot of follicles, all right, that are abnormally arranged. Once you do your scan, you'll be able to pick that up. In addition to that, she has irregular menstruation. A lot of women who have irregular menstruations, if you do your evaluation, you discover that a lot of them, it's as a result of PCOS. And then they have abnormal hormones, high levels of androgens. So you have hyperandrogenism. And so you see some women who have male pattern hair distribution. They have hairs on the chin, they have hairs on the sides, on the chest, and the pubic hair. So they have abnormal hair distribution. So once you have two out of those three conditions put together, will give you what we call the polycystic ovarian disease syndrome. All right, and it's a very common cause of anovulation. Then you have high levels of prolactin. All right, high levels of prolactin, and then you have thyroid disease. These are all conditions that can cause a woman not to ovulate. And how would you know if a woman has high prolactin? Women will begin to produce milk from the breast. A woman is supposed to have produced milk after she has delivered, and she wants to start breastfeeding. But when a woman is not pregnant and her milk comes out, milkish substance comes out from whitish substance comes out from her breast, most times that could be an indication that her prolactin levels are high. All right. And then, of course, you have thyroid disease, particularly hypothyroidism, where the levels of thyroid hormones are low. Then the next factor is tuber factor. All right. Tubal factor means that the tubes, which are very important in reproduction in the woman, they are damaged. Fertilization takes place in the ampullary region of the tube. What that means is that the egg is released from the ovary. The tube, the distal end of the tube, the fimbra, is very close to the ovary. So the egg will be collected by the tubes and will be at the ampullary region, and that will significantly damage the tubes. All right? And so these are some of the factors that would damage the tubes and they'll bring about the tubal factors. Then you have the uterine factors. Examples of that are uterine syncytial, meaning that infection affecting the endometrium, endometritis, or you have a submucous fibroid. That means a fibroid that is right inside the womb. All of these would lead to implantation not taking place. All right, it will hinder implantation, and then, of course, the woman will not be able to get pregnant. Then you have cervical factors, antibodies, stenosis, infection, and then pelvic factors, endometriosis again will play a role, and then infection. So the question will not be who is to blame, all right? Because it takes two to tango. Seeing that it's evenly distributed in terms of the causes, all right? And so what is needed is that the couple needs to come together. They need to be united to ensure that they find solution to the challenge, which is to achieve conception, not telling, oh, you are the one that is to blame. You know, in those days, men didn't used to come to the hospital for fertility checkup. It's the women that you see. They would send the woman. Why? Because the man believes that he doesn't have a problem. But the typical Nigerian man doesn't think that he has a problem. Me have a problem. It's not possible. You are the one that has a problem. Go to the hospital and have yourself checked. But I think that thought is not changing. That belief is not changing. So you're not seeing. We are now seeing the couple, both the man and the woman, come together to get evaluated and then get treated. All right? So if there's a challenge, what I advise is that the couple should come to a hospital, should go to a good fertility clinic and get evaluated and get treatment. Okay, so next slide. There's another important issue I want us to quickly look at, and that is this very frequently asked question. I'm above 50 years. What are my chances? What that means is that a woman who is 50, a woman who is advanced in age, is there a chance for her to get pregnant? A woman who has stopped seeing her period, she has entered menopause, is there a chance for her, or has the chapter closed? All right, there are many who believe that, see, my time has passed. I have closed that chapter. I have moved on. The good news is that for a woman, even at 50, who probably have stopped menstruating, there is hope. It's important for us to know that age is a very important factor. It's a major factor that affects fertility. As a couple gets older, particularly a woman, fertility decreases. What is the peak age for a woman's fertility? A woman in her 20s is at her peak. By the time she gets to 30, there's a bit of a drop. By the time she gets to 35, then there is a significant drop. As she's approaching 40, that drop becomes really, really low. By the time you see a woman in her 40s, the chances of getting pregnant has really reduced significantly. For the man, it's a bit different. For a man, you need to get to 60 for you to experience a bit of a drop in your fertility potentials. But that does not mean, that's why you see a man, even at 70, he's still firing and still achieving, still scoring goals. All right. But for the woman, it's not so. And that is why for women, age is a very important factor. And that is why what has to be done as soon as possible. Unfortunately, in the day we live right now, a lot of ladies are not getting married early. So if we are saying that the peak of a woman's fertility is in her 20s, therefore means that by the time most women are getting married, they are not in their peak. Because a lot of ladies at 30, they've not even started. The man is not even there. And you may ask me, well, why is this so, doctor? Well, a lot of factors. Okay? The economy is not smiling at all. A lot of women are trying to pursue careers because they just must work. They must earn a living because the man alone cannot carry it. So the woman has to be able to be engaged economically. And so all of these factors has made it really impossible for ladies to get married on time. In our mother's time, by the time a woman is 25, she most likely have already started she has had her first or second child. But now that is not the case. So this poses a lot of challenge, really. All right. But like I said, the good news is that although a woman has advanced in age, she can still be able to get pregnant. Next slide, please. But the important fact for us to note is that, the important fact for us to note is that the chance of a woman who is 50 getting pregnant using her eggs is almost non-existent. Why? Because a woman who is 50, the ovarian reserve is almost empty, it's almost zero. When we say ovarian reserve, we mean the number of eggs, the quantity of eggs that she has is almost not there, it's almost exhausted. A lot of women, by the time they are in their 50s, they are either entered menopause or they're about entering menopause. But we even see a lot of women now who are getting into premature menopause, meaning that before they're even 40, they're already getting into menopause. And when we say menopause, it means that ovaries have stopped functioning, eggs have been depleted, and there are no more eggs. And then more importantly is the fact that the quality of the egg is also very, very low. Because the quality of the egg is tied to the age of the woman. Why? Because the older a woman is, the less the quality of the eggs. I think that the egg is probably one of the oldest cell in the body because the eggs were formed when the woman was staying in the womb. At 24 weeks was when those eggs were produced. And from that time, those eggs were programmed to begin to diminish. And that is why you see that at the first stage of production of eggs, a woman could have between 7 to 20 million eggs. By the time she is born, that number has reduced to 1 to 2 million. By the time she gets to puberty, that number has further reduced to 400,000. And then once she goes in, she starts her reproductive phase, she releases one egg every month. But it's not one egg that starts the journey. A number of eggs are recruited, but only one is released. The others, what happens to them? They die off. So by the time she gets to her 40s, the number of eggs that she has not only has depleted, but the quality of the egg has reduced. And so with that, you have a lot of abnormalities associated with those low quality eggs. That is why pregnancy is very difficult to achieve. So how does a woman who is in her 50s, and let me probably just extend this so that some will say, oh, I'm 45, that means I can use my egg. Oh, I'm 42, I can also use my egg. Now let me extend this a bit. Like I said before, when a woman gets to her 40s, quality of egg reduces significantly. So when you're seeing a woman who is 40, the quality of her egg reduces. In fact, it actually starts from 35. That is when we begin to experience this challenge. But it grows, it gets worse as the woman ages. So by the time she's approaching 40, 30, 39, 38, 39, 40, it's actually speaking. By the time she gets into her 40s, it's actually is a factor. So for these categories of women, the lifeline for them to be able to carry a healthy baby is through what we call a third-party program, meaning egg donation. Yes, I know that is something that a lot of women don't want to hear, they don't want to believe, they don't want to agree to, but the truth of the matter is that the only way a woman can be able to reproduce and produce a healthy baby is by having egg donated from a much younger donor and inseminated with a sperm of the spouse to produce embryos that will be transferred to her. So she will carry the pregnancy, but not her egg. Her egg will not be used. So the question that readily comes up is, will the child look like me? Will the child carry my gene? Will the child carry my traits? Will the child carry my fine nose or my beautiful eyes? Unfortunately, the answer is no. Why? Because it is the egg that contains the DNA, the genetics that produces all of those features. All right? So the child will not carry your DNA, but the child will carry the DNA of your husband. All right? So it's a compromise, okay? Because if not for this technology and the ability to be able to do this, there are a lot of women who will not have been able to carry a pregnancy. And I tell a lot of my patients that going through a third-party program is 1,000,000 times better than adoption. Why? Because in adoption, both gametes are not from either of you. You did not carry the pregnancy. You are adopting a child, which, by the way, is a very wonderful thing. To be able to have a child to pour all your love and care on is wonderful. But as humans, you want to be able to feel what it means to carry a pregnancy. And the third-party program gives us that opportunity to be able to do that. All right? And then more importantly is the fact that it's your husband's sperm that will be used. And so we see situations where a woman goes through this third-party program, and the child looks very much like the man, and sometimes even looks like the woman. Somehow there is this familiarity. So it's something that a lot of women are embracing now. Why? Because let me say this. It will surprise you to know that more than 50% of our programs are third-party programs. And that's the truth. Why? Because a lot of women who are coming in for fertility are coming in their 40s. They're coming in late. So, and that is the only way we can be able to ensure that they're able to have their heart desires met. So through IVF egg donation program, a 50-year-old woman has above 50% chance of conception. All right? So I will say that very clearly, you have a very good chance of getting pregnant and having a healthy baby. All right? Now, So that will cover us, yes, cover some grounds. The challenge will be, how does this work? This egg donation thing. Because we run Abebe Fertility Center. We run a complete anonymous egg donation program, meaning that the donor doesn't know you and you don't know the donor. Things that we look at and we try to a good, all right, for patients who are going through a third-party program, all right, and then we go ahead. Like I said before, it's a lot of couples who are coming in for treatment. That is the process by which they are achieving pregnancy. Because the other thing you also need to note is that you don't only want to get pregnant, you want to get pregnant and have a healthy child. Because apart from the fact that it is difficult to achieve conception when you're using eggs from couples that are in their 40s to 50s, is the fact that there is increased risk of miscarriages. Even when they get pregnant, there's an increased risk of miscarriage. And even when they don't miscarry, there's an increased risk of abnormalities with the baby, all right, Down syndrome and all of that. So it's really something that we really have looked at, and the third-party program holds a lot of benefits for a woman to be able to reproduce and have a healthy baby. Another issue that is also very important, which patients are trying to handle, is how they're able to access fertility care remotely. So can I access fertility care remotely? We are based in Abuja, all right? And a lot of patients are not in Abuja. They come from virtually the whole world, really. We have patients who come all the way from Australia, from the United States, from Europe, all right? And of course, from within Nigeria. So because that we have a very large clientele of patients who are not based in Abuja, we have tailored our treatment to make it convenient and as simple as possible, so that it's not a lot of challenge, because we recognize that it could be a very big logistic challenge for couples who are not based in Abuja to be able to come to Abuja and access care. We are trusting God that not long from now, we'll be able to have centers open in other parts of the country, all right, so that the proximity will not be too long, so that to access care without having to travel a very long distance. The way we have tailored our treatment to make it possible for patients to access care is to try and reduce the amount of time that patients are required to be in Abuja. Typically, an IVF treatment could take between 4 to 6 weeks, sometimes 8 weeks, all right? And that is a lot of time for a couple to sacrifice, to be out of their base, out of work, out of family, all right? It's a lot of time. Most couples will not be able to get that kind of time out of work. So what have we done? We have done it in such a way that with 2 visits, we can reduce the time that you will spend in Abuja, excuse me, to less than 2 weeks. The first visit, just 1 or 2 days, all right? And that first visit, you come in to have your initial evaluation done, you have your registration. In fact, you can actually have your registration and consultation online before you even come in. But while you're coming in for your first visit to the clinic, you're coming in and then you're having your investigations done. Then you have some other procedures that will be done for you in preparation for the main program. And then you'll be given your medications and you're ready to hit the ground running. So that the second visit, which is for the main program, you will not have to spend that long. All you need to spend will be between 1 to 2 weeks. All right? And so with this, we have been able to reduce time quickly, and patients are able to plan this with this tailored program to go through our program. And what that means is that for us to be able to do this, it means that your program will be planned and you will start off your program before you come in. All that will require you to do or have access to is for you to be able to do a transvaginal scan. Once you can do a transvaginal scan in your base, then we can be able to accommodate this plan. All right? Accommodation is not a challenge. Even if you don't know anybody in Abuja, we will accommodate you, of course, at a fee. All right? And then we can also make it possible for your spouse to visit just once. Rather than make 2 visits, your spouse can actually come once. All right? And how do we do this? When it comes in for his initial evaluation, if everything goes well, all right, and it's very difficult for him to come again, we can go ahead and freeze his sperm. And then when the time for the main program comes, then we can use the sperm. All right? So that is how we are able to provide care to patients from every part of the country, from around the world. We have highly trained specialists, doctors and nurses who are able to communicate and carry you along with your program, even if you are not in Abuja. Okay. Now, some would say, oh, the cost of treatment overall, will it not be too much? Can you add the cost of flight, the cost of accommodation and all of that? Well, I will say that if you put together, at the end of the day, cost-wise, you still have a better deal coming to Abuja. Why? Because a lot of our patients, they go through our foundation program, which is already significantly discounted, and which is exactly the same with our normal program. And then you're getting quality care. All right. So at the end of the day, it's still more cost effective. You're getting more value. All right. In spite of the fact that you have to come all the way to Abuja. And like I said before, we have reduced significantly the amount of time you have to stay in Abuja. So what that means, the cost of accommodation also has gone down drastically. Okay. So I'm sure I've been able to throw more light into that. I'm sure if there are more questions about that in the question and answer session, we'll look at it. Then a very important issue, next slide, please. How do I finance my fertility treatments? This is a major issue. It's important for us to know that 60 to 70% of infertile couples will require IVF as the treatment option. You know, a lot of couples feel that, oh, IVF is the very last resort. Let's try every other thing. No. In 60 to 70% of couples, IVF is the first option. It's the only option. A woman who has blocked tubes, IVF is the main option, is the most viable option. A couple that has severe male factor infertility, IVF, ICSI, is the first line of treatment. In couples who have ovulatory factor, all right, some of them are using ovulation, using agents like clopidogrel, letrozole, and it hasn't worked. Some have even tried IUI. Again, large percentage of those patients end up going for IVF. So if you look at couples who are coming in for treatment will require IVF. Unfortunately, IVF treatment is very expensive. Unfortunately, all over the world, IVF treatment is very expensive. And the vast majority of couples in Nigeria cannot afford it. So financing such a program becomes a huge challenge. And that is why, since the Abebe Fertility Center started, we have largely run very discounted programs through the Abebe Art Foundation. And why have we done this? Is to provide access, provide affordability to couples who are trying to put resources together to come for treatment. But 2 years ago, we started the Be Fruitful project. It was, I would say, a very ambitious program to reach out to 10,000 couples with IVF treatment in 5 years. We marked the second year anniversary in February this year. And to the glory of God, we have had more than 6,000 couples that have registered, more than 3,000 couples that have gone through consultation. We've had more than 600 that have gone through fertility treatments, and over 260 have been confirmed pregnant. All right. And so the program is still on. And through that program, we have been able to provide we've made IVF treatment very, at least reasonably affordable. When we started that program, 2 cycles of IVF was put at 500. And that also included part of your tests. It included your registration and consultation and part of treatment. All right. So when that program came out, most people did not believe it. They thought that it was a scam. Like, how is it possible? But we started, and God helped us. But over the last 2 years since the program started, we have had to, unfortunately, step up the price gradually. Why? Because of the economic realities, okay, that we had to face in this country. So currently, right now, 2 cycles of IVF is going for 700. And then you have investigations, which you need to pay for, depending on what you're doing. And then there's some additional costs that will apply based on what particular program you are doing. But even with what is currently being offered, it is still significantly discounted. Unfortunately, again, from the 1st of April, those prices will be adjusted. Why? Because of the, like I said, the economic realities. Inflation has really, really affected a lot of things. Next slide. So you see, the first option that we provide for patients who want to be able to go through this program is through Fruitful program organized by the Abebe Art Foundation. So I'm sure as we get to the end of this presentation, the website address and the phone number to call will be displayed so that you can call, and then our office staff will to help you to assess and gain all the necessary information that is needed. Now, we also introduced what we call the Joje IF savings scheme. And so we introduced a savings scheme where you can open an account and then in what you have to save up to meet up with the program. All right. That is on. If you want to find out more about that page, you can call one of our office staff and they'll give you the details concerning that. Then thirdly, we also have this collaboration with Access Bank. All right. We have a collaboration with Access Bank. Now, the reason why, and then you pay, interest rate is low, is a single digit, and then it provides you with a lot of flexibility in terms of the payment. All right. Now, the reason why this, I think a lot of our patients should begin to consider this is because, you see, it's always better for you to get pregnant as soon as possible. Like we just said, age is a factor in determining success. So I will say to a couple who is trying to get, if it's to access the fund, it's better for you to access the fund program now rather than later, because as the months pass by, it becomes increasingly more difficult for you to achieve your heart desires. Okay. So these are the options that we have. So please, you can later on call one of our office staff to be able to get more details as to how you can be part of any of these options that I've discussed about. Okay, so I'm coming gradually to the end of this presentation, but before I end, it's important for me to talk about our success rate. Next slide, please. Our success rates, because in deciding which center to go to, which center to pick to do your program, I'm sure everyone wants to find out what's your success rate. We tell patients it's not about the costs, it's about where you will get value for money. Now, the figures I've put there is just the figures of last year, because I felt that our most recent figures. So last year we had a 47.7% average success rate from all the different programs. The average was 47.7%. And in some of our programs, like the third party, we had above 56%. And then in one of our batches, we run our programs every month, in monthly batch. So in one of our batch, we had a 75% success. So if you ask me, I'll say that this is not a bad showing. All right, it's not a bad at all. And we are also striving to make sure that we increase our success rate, and we will do everything possible to make sure that we continue to offer excellent and quality service. Okay, next slide. So how can I start my journey to parenthood? So the first step is to look for a good fertility center, look for a partner. You don't just need a fertility center, you need a partner. You need someone who will partner with you to go on this journey. It's a journey. We call it the journey to parenthood. You need a partner who will be there for you, who will support you, because sometimes this journey can take longer than is necessary. I remember while we were going through our own journey, our journey, by the way, lasted for 6 years. So some people would come in and within 9 months. So you want to know what it will cost, and then you begin to plan, and then you take steps. So I encourage anyone who wants to start this journey, call, make all your inquiries, ask all the questions, go to our website, go through all our videos, all right, that we've made. Get information, be equipped with information. And then number 3, begin to plan. Make plans financially because you need money. Make plans spiritually because you need to also ensure that you prepare the atmosphere. And then prepare psychologically, all right, because it can be a journey, actually. Sometimes for couples who go through this process, it's not a sprint, it's a marathon. Okay? And so once you have done that, then call. Take that first step. Call to book an appointment to start your journey, and then begin to take further steps of faith. And I can assure you very shortly from when you've started, you will begin to have amazing results. Everyone who has gotten pregnant, who have had their babies, took that first step. And I know that as you take that first step, very shortly, it will be your turn to have your heart desires met. And then next, when can I start my journey to parenthood? You can start today. Call that number, visit our websites, the fertility website and the foundation's website, get information, call, and our team will be ready to receive you and to guide you, providing all the necessary support to ensure that you become a joyful parent. Okay, so we'll go for a very quick commercial break. And please, just those who want to ask questions live, just prepare your questions. Those who want to send in their questions, if you've not done that already, send in your questions and we'll try and go through your questions. See you in a bit.
Welcome. My name is Elizabeth Wachku. I'll be giving you a brief but detailed information about Jode Fertility Center, Jode Art Foundation, and Be Fruitful Project. Jode Abebe Art Foundation is a non-profitable organization. Our mission, among other things, is to be a support system to couples who are trying to achieve conception and ensure that they become joyful parents. We hope that through our discounted art services, in collaboration with Jode Abebe Fertility Center, many will be inspired and motivated, encouraged to start this journey to parenthood, which because of high costs may have refused to start at all. The vision that founded Jode Abebe Art Foundation was born out of a personal experience, having dealt with the burden of infertility for 13 years. Before having our babies, we understand the difficulties associated with infertility, especially the high cost of treatment, which has made many couples to close the chapter of human reproduction and have accepted infertility or barrenness as their fate or lot in life. Therefore, our vision is to provide a support system that facilitates the journey to parenthood, and our mission is to provide all the necessary support to couples trying to achieve conception. What do? We make fertility treatment affordable to infertile couples who can't afford it through financial discount. We create awareness about the available treatment option for infertility through a special educational program. We also provide the much needed psychological, emotional, and spiritual support to our clients before, during, and after the treatment. Offer free fertility counseling and consultation services. Stages of journey to parenthood: fertility treatment stage, pregnancy stage, post-pregnancy stage. Being challenged in life is inevitable. Being defeated is optional. Roger Ruford said that. Listen to some of the beautiful success stories of our clients who have waited for years but received their bundle of joy through the Be Fruitful Project and be inspired. Let hope rise within you.
My name is Idowu Olaide. I want to give glory to God. God is awesome. For 19 years, we've been going helter-skelter from one place to the other. I've had IVF in one hospital that I don't want to mention. Like the woman said, they made mess of me. But, that was 2010. So I lost hope. I said I was not going to do anything again. Until in 2019, somebody introduced me to doctor. So I came. In fact, the day I came, the way he talked to me, in fact, I was relaxed. I said, yes, I think something can be done here. And we started the procedure. Like the woman said, the money was not there. But, one thing I like with him is like, it will allow you to pay in bits. Even if you don't have the money, or allow you say, don't worry, you can pay in bits. And one thing that happened that, that I really have to say here because of other people is that, I tried it once with him and the thing failed. I felt dejected. I was crying in his office. He encouraged me. So he now told me, I said, the money wasn't there. He said, don't worry. You can pay small, small. And that was how we took it up and we paid some. Then we started the second time. And to God be the glory. I remembered when I was in theater, I told him, I said, I wanted three plates. That's what I wanted. He said, okay. He said, no, he's going to give me two. I said, no, three. He said, we should agree. I said, no, it's three. So we argued as he said, he now did it. And to God be the glory. I told him, I said, I wanted 2 boys, 1 girl. And exactly that was what happened. But, the 2 are here. 1, I lost 1. But I just thank God for what he did. I just want to encourage others. Please, hope is not lost. God is still there. God is faithful. God that did it for me, he will do it for all. Don't lose hope. No matter what. This our doctor, in fact, is a God sent. And, I've introduced a lot of people. And I thank God today. I'm hearing the testimony. I praise the Lord.
Sorry, I'm going to take a little of your time. The day I found out I was pregnant after 15 years. Okay, before then, when I first got to the doctor's office, in fact, I was kind of lost. I managed to get to the hospital. When I saw him, I just started crying. Like, why are you crying? He said, my hope is gone. So why? Said, I've been trying to give birth. I have not been able. Say, don't worry. God is on the throne. He will do it for you. Actually, I did it first. I didn't know what happened. It didn't work well. So he just told me, let it go. I said, no, I won't let it go. Even if it's going to be half, let me just do it. Because the pressure is really on me. Say, don't worry, let it go. This one that will stay will come. I bet you on it. So I let it go. I lost it. To the glory of God, when these ones came, it's should I say epic, beautiful. I had a song in mind. And when he told me I was pregnant, I just laid down and started singing. You are God from beginning to the end by yourself. Praise the Lord. I just want to encourage every one of us, those who are still believing God. God is still in the business of doing miracles. God is still there to see you through. I remember the day of the procedure, he asked me, how many do you want? I said 3 or 4. If possible 4. He said, you can't carry 4. I will just give you 3. I said, okay. 3. I still want 4. He said 2. I said, doctor, just give me 3 and let me go. So I want to say, doctor, thank you. God bless you. And may God strengthen you more. May God give you the wisdom to do more. And give you the strength to do what you always do. Praise the Lord.
Praise.
All right, so thank you very much. We are back.